So this afternoon we spoke about research, and this is treatment research. So we will have a discussion of a variety of trials that have taken place, both safety and randomized trials, and we will have some interesting talk right now by Dr. Grozdinski, who will talk about the application of stem cells in the treatment of multiple sclerosis.
Thank you for this kind invitation to be part of that great team. I'm a specialist of cell therapy and gene therapy, and usually my profession is like a tailor. People come to me and I make a proper suit for them, and it happens for many groups who have different ideas for treatment in Bulgaria with cells. And actually I'm very happy that we meet with Dr. Ivo Petrov and started to work, but we have also done a lot of job in the field of cell therapy in multiple sclerosis and regenerative therapy. I have no financial relationship to disclose, and to understand this field, maybe at first we must to know what is the philosophy. For me, everywhere is easy to be understand if you have some kind of philosophy, and this is that we can achieve some good results with CCSVI therapy, and after that we have no chance to move ahead. So the chance to move ahead, if you want to improve the symptoms, it is actually the regenerative medicine. And there is, you can't imagine how many groups now working in this field. And being here, I understand that actually many of them are like people who swim against the flow, because we didn't remove the problem, but nevertheless a lot of these people receive very good results, and I actually have contact with 5 groups and have a contacts and see, and you can't imagine how many patients have been done. For example, one of the group of Italy have been done more than 200 patients with MS and stem cell therapy. So this is what is interesting. I think that now we must to make appreciate different kinds of therapy through the view of CCSVI approach. It means that many of the positions which we know, we cannot explain what happened, and now we have some possibility or maybe some chance, or we're close to the truth what is happening. For me as a hematologist, of course the most interesting field is transplantation of bone marrow, and something happened which is very unusual, and I would like to share with you, because I think that that kind of information can be useful. So it is very interesting that multiple sclerosis have unusual behavior. That's why it is possible to have some explanation, absence of transfer of MS after allogeneic stem cell transplantation. What is mean this? If you have a patient who is suffering from other kind of disease, and he have a donor who is suffering from multiple sclerosis, we didn't look and we didn't find the transfer of multiple sclerosis, which happened with other immunological disease. So it is going to speak that there is a local problem, and if you solve the local problem, I didn't say that it is just CCSVI, but if you solve this problem, it can happen that disease is not going to develop. It means that genetic factors are important, but less important as the immunological aspect. So other is very interesting, which is happening. It is a progression of multiple sclerosis after allogeneic stem cell transplantation, and it was not so far ago when I was in a congress in Istanbul, and there is a special topic about autoimmune disease, and one of the topics was from United States that we perform allogenic transplantation in expectation that we're going totally to cure disease. You know that in allogenic transplantation, usually the death rate is around 40%. For good reason, in that case, there is no dead cases reported by this colleague, but I shall show something later which is incredibly interesting, that there is a progression of this disease after stem cell allogeneic transplantation. And also we can explain why the possible progression of MS after autologous transplantation. This is what I speak, and here we see the diseases which can be transferred by allogenic transplantation. It means that the donor is suffering from immune disease and recipient accepted disease. It is happening in diabetes mellitus, immune thrombocytic purpura, psoriasis, myasthenia, ulcerative colitis, Crowne, and it happens usually from 5 months to 8 years. And it is very interesting to see disease which never have transfer. It happened with multiple sclerosis, lupus erythematosus, and rheumatoid arthritis. And there is a lot of common things which you can take from treatment of one disease to another, which is the lower part. So this is what I appreciate. People who are suffering from hematological disease, they receive. It's interesting to know that in the beginning, the source of stem cells is bone marrow. You see here. The source usually in the beginning is bone marrow, which is very interesting. So this is very interesting case, and it is come from Canada, 2010. After autopsy of 4 patients with multiple sclerosis who died after allo stem cell transplantation for concomitant hematological malignant neoplasm, relevant that months after that, demyelinization and inflammatory activities of MS patients persist in all the patients with MS. Active and chronic active MS lesion exhibit significantly high number of CD3 positive cells and CD8 toxic T cells, and significantly higher scores of CD68 microglia and macrophages that did chronic inactive lesions of normal appearing white matter. So it means that in the lesions we have quite stronger inflammation. We have also all over around the brain. And when it is make the same control group with 5 patients from MS, would just die from without MS, who died from after allogenic stem cell transplantation, we find also that there is the same cells but less than in MS patients. And of course in control group with people who die in other cause of disease, there is no such a things. I think it is incredible, interesting, and show why the disease is progressing, and that the things which happen locally, factors, lead to cell inflammation and totally different biological approach of multiple sclerosis. So this is what we discuss. Autologous stem cell transplantation is very interesting as a history, because actually this is a history of regenerative medicine, and we make so many cases, and we didn't think like a regenerative approach, we think like immunological approach. And here there are different diseases which have been treated. Patient is suffering from hematological disease and also is suffering from immunological disease, and after we apply autologous stem cell transplantation, you cure both of these disease. So by this way appeared the idea to start the treatment of immune disease with autologous stem cell transplantation to depress the immune reaction. So it is interesting that the mechanism of treatment is still unknown. Probably the chemotherapy leads to the profound and long-lasting lymphopenia. Autologous stem cell transplantation reestablishes immunological tolerance. Reactivation of thymic function after autologous stem cell transplantation leads to the tolerant immune system, and anti-thymocyte globulin directly target the long-living autoantibody producing plasma cells. So after 14 years use of this kind of treatment, actually we have improvement around 70% at least 3 years after transplantation. And I want to look at this through the regenerative approach. We must look through the regenerative medicine. Some of the results of improvement can be explained by regenerative function of transfused stem cells. But the problem is that the main source for stem cells, for autologous stem cells, are mainly peripheral blood stem cells, which are less effective than bone marrow derived stem cells. So it is another phenomenon which is very interesting. After chemotherapy, we find the memory loss, attention deficit, difficulty learning, and mood changes. And this is because the direct neurotoxic effect of chemo agents and hormonal change which is induced by treatment. Of course, the age is important, genetic factors are important, and usually it is passed from 1 year to some years. So it's something very interesting. We look at the patient, usually make chemotherapy because disease is very active, and after that we make extremely strong chemotherapy with transplantation, and after that we see the results. And we didn't take in care that in this moment we make a big damage to the brain. So this is not accepted as a result of some kind of regeneration of the things, cells maybe, which we're doing. So about regenerative medicine and stem cell therapy, there is a very big field, and everywhere is working a lot. Even in a plastic surgery, I shall tell you that I have been in one center in Turkey. There is a big expansion. For example, for the breast enlargement, there have been used around 600 cases with bone marrow derived stem cells. They mix with fat tissue, and by this way they have a normal fat tissue. Usually the principle of regenerative medicine in a different field are the same. When one organ, brain, skin, or heart is damaged, signals of damage reach bone marrow. Bone marrow responds to increased stem cell production, and more stem cell appeared in blood circulation, and usually it began on day 3rd. There is a lot of publication which cells have been increased, and now it is the day 3rd is shown to be the first day when they appeared. And new appear stem cells in the blood circulation, and organ-specific stem cells participate in damaged organ regeneration. Inflammation around damage help for cell penetration, and these are the most often examined cells. These are CD30 positive and negative, and CD133 positive and negative cells. There is a lot of papers, and it can be seen what about the smoker, what about diabetes mellitus. There is a difference, but actually there is a lot of work. Unfortunately for the brain, there is no publication. It is for all other damages. This is about the signals in the brains which usually participate about the scheme which we showed before. So the main mechanism, we can say that they are unknown, but there is a lot of data that this exists. Stem cells can make a new blood vessel, and I shall show how it can be used. Paracrine mechanism, it is when the animal models, rat, we make spinal cord injury or stroke, and we put human stem cells from bone marrow. The regeneration is extremely quick, and only paracrine mechanism can explain the situation. And cell transdifferentiation and cell fusion, now many groups make from bone marrow neurons and in different steps of differentiation, and they put the good thing in that way that you can put intravenously, and they can directly go to the brain. And the last effect is a bone marrow derived stem cell strong immunomodulatory function, which if you apply just bone marrow or cord blood, for example, stem cells, you can receive immunomodulation. For example, you have a patient in the beginning of diabetes, you put cord blood cells, and you postpone disease with 1 year. So it is can be proved by this way. Here I can show one case. It is a young female who is suffering from trauma from soccer. You see the part of neuro procedures, and the basin of and the right ear is destroyed, and basin of the right arteria temporalis there is missing. If you cut this part, there is absolutely no bleeding. It's like was like porcelain if you go inside. And she have three. Of course, you make neurosurgery, plastic surgery, and after that she tried to put ear, and the plastic surgeon tried 3 times, and because lack of vascularity, they didn't succeed. So they decided to make, we decided to make new vessels, and after that to put artificial ear. So our idea was to stimulate neoangiogenesis by bone marrow-derived stem cell and platelet-derived growth factors, and to support the operation with the same factors. The treatment, we took 120 ml bone marrow, and we processed and injected to that area. 5 months later, we make autoplasty with the implant, and after 30 months, it was successful already, and it was very important for her to have a normal life. Alternative method, it is a platelet. It's incredible field, and I work a lot with dentists. We do many things with platelet as a regenerative approach. This is very important about the stem cell niches. Stem cell is only, we must understand that the stem cell is only stem cell when this cell is in the niche. Leaving the niche, it is losing his immortal function, and that's why sometimes when we apply stem cell in an unusual place, they have shorter life. Not if you put the bone marrow stem cell in the bone marrow, they have a long life. But if you put in the other tissue, the life can be 1 year, 2 year, or 3 year. So this is because there is no niches there. Our experience with stem cell, we have more than 850 cases with stem cell application as regenerative approach. And this was mainly bone marrow-derived stem cell in spinal cord injury, cerebral palsy, stroke, multiple sclerosis, and Parkinson's disease. And we have, as experience with stem cell, 356 cases in hematological malignancies and 783 cases of processing of cord blood. And here I want to explain some preliminary results, some previous experience with stem cell and multiple sclerosis treatment. In the National Center in Neurology, they ask, I'm working in National Center of Hematology, to have a product which is containing glucosides and platelets from half a liter of blood, and they apply this intrathecally and have a good result, but unfortunately the professor who was leading this group died. We make 14 cases, and it was general idea. A lot of people made interferon intrathecally. There is such a movement, but never mind, we received something which we know, and after that we can also there is another kind of movement of regenerative medicine for applying stem cell in a different position. Our congresses of hematology have been full of reports before, and after that all this group go to the regenerative medicine and disappear from our congresses. But we have a big experience with bone marrow-derived stem cell, which we applied with lumbar puncture. Concerning multiple sclerosis, it was 26 cases and 7 positive results. This means that only stem cell alone, just bone marrow-derived cell, give some results. Here we showed what happened. One of patients which have improvement, patient who is suffering from 2000 years, have muscle weakness, can walk 200, 300 meters, pain in left leg, double vision, bladder incontinence, and regional cell transplantation, lumbar puncture 2008, and results increase in muscle strength, walk distance of more than a mile, disappearing of double vision and bladder incontinence. And this is a patient who have suffering similar, and he have 2 injections as a difference, and actually have very big disability. And he increased in muscle strength, ability to raise, to keep the head in upright position, to stand up, to handle the keyboard and computer, to control a wheelchair. So this is why we try to make combination with CCSVI and stem cell therapy. We expect faster and stronger improvement of clinical symptoms after combination of these 2 methods. And also some of the side effects concerning obstruction, vein obstruction, maybe can be can be solved. And as you look, we are looking always for signals. This is the best time when the signals from the brains come and can attract the stem cell if you apply at that moment. Of course, it must be proven. We collect 350, 400 milliliter. Patient performed CCSVI treatment, and stem cells are applied in the brain artery. Erythrocyte and remaining stem cells are applied intravenously. This is a bone marrow collection. This is what is new, that now you use a back and it is in thoroughly closed system, which guarantee better sterility. Our processing is in the Hess method, which we catch all the cells which with more weight than 1.90, and the method is the most established method in the stem cell processing of bone marrow. And critical place is filtration of with 40 micron filter, which I see that some of publication which use bone marrow didn't make, and it's make a problem. If you didn't make a 40 micron filter, these cells which you apply stop mainly in the lung, and especially if you use our method, it can be even dangerous because you can block the arteries. If the size is bigger, you can make micro stroke or microinfarction. If you use the heart, we remove the platelets. And here are bone marrow, some of the bone marrow cells which are very important. And this is interesting that there are very small amount, and you see here that all of this mesenchymal or embryonic-like stem cell, which contains in the bone marrow, they are different, and only one is in fat tissue, and other have can be found in a different structure, and there is a characteristic of endo, ecto, and meso tissue can be restored. And this is a final product. And this is just the last thing what I said. This is here we can receive the answer of the question, what time you can better to apply the stem cell, after or before CCSVI therapy. And on the imaging you see the holes, which is patches of multiple sclerosis, and they restore perfusion after CCSVI is made. It means that if we do the cells after CCSVI treatment, the cells will pass closer to the damaged area, so maybe it is going to be better effect after that.